Thank you for taking time to join. We assure you a very meaningful discussion today. I'm Dr. Newton Isaac. I've been in the development field for 33 years, and I worked as a regional head in state of Madhya Pradesh, Chhattisgarh, Maharashtra, Gujarat, AP, Telangana, Karnataka prior to joining CHAI. That's my small introduction. And currently, I work with CHAI as a lead capacity building and network strengthening. It's indeed my pleasure to moderate today's webinar. Now, I invite our Director General to welcome the participants. And before our Director General joins, let me introduce Father Matthew Abraham is a Redemptorist priest with MBBS from Kottayam Medical College and MD in Community Medicine from Christian Medical College, Vellore. He was president of the Christian Coalition for Health. He chaired both Engage Disability and Link Asia, an Indian and Pan-Asian Disability Inclusive Network. He was Health Secretary of the Catholic Bishops' Conference in India from 2008 till 2015. Father Matthew Abraham is very passionate about affordable and compassionate care and has constituted significant initiatives to strengthen members' institutions, especially through strengthening network and collaboration. He is a philanthropist by heart, and I'm happy to say that this webinar is an original idea and brainchild of Father Matthew Abraham. So I invite Father Matthew to give away the welcome to the participants. Over to Father Matthew.
Thank you, Dr. Newton, for the introduction, and so glad to see Dr. Muralidharan and Dr. Shekhar Seshadri. These are well-known and eminent speakers from reputed institutions. So, and I was so glad to see all of you. Quite a good number of people have joined for this webinar. Nice to see that. So, dear friends, COVID-19 took us all by surprise, and the second wave was even more difficult. Many people went through immense suffering, including the loss of their loved ones. That is one side of the story. The other side of the story is that the caregivers also had to go through much suffering. They had to witness the unimaginable suffering and reactions of patients as well as their close relatives. Not only the doctors and the nurses went through suffering, but also those who gave leadership and managed the hospitals went through tremendous stress, and some got burned out. This is the context in which we are organizing this webinar. We have good speakers from NIMHANS, the premier institute of mental health in India. We also have experience sharing by our own sisters, one sister nurse, one sister doctor, and one administrator. I'm glad to see so many of you taking time to attend this webinar. And I use this opportunity to officially welcome the speakers and each one of you for this webinar. I wish you all the best, happy learning, and over to you, Dr. Newton.
Thank you, Father Matthew. Now, let's proceed. Now, let me share the objectives of the webinar. It is needless to say that mental health plays a very crucial role in fighting COVID-19. This webinar aims to provide information on managing stress and building resilience. The very specific objective is to help healthcare professionals to understand symptoms of stress and burnout during pandemic and suggest measures for self-care by early detection and management of stress and burnout. And also, I would like to just share the agenda of the today's webinar. We just finished the anthem and welcome address by our Director General. We have two main speakers, Dr. Muralidharan Keshwan from NIMHANS, then Dr. P. Shekhar Seshadri from NIMHANS. Then as Father Matthew mentioned, we have three sisters who would be sharing from their experience. Dr. Sister Annie Sheila, Sister Thompsama Yadapalli, Sister Marina Abraham. Then we will have a question answer session where we'll be taking up questions from the participants. Then we will have concluding remarks from our President of CHAI, Sister Victoria Narsetti. So that's the order of our webinar today. And let's move to our first speaker. Today's first speaker is Dr. Muralidharan Keshwar. We are so grateful for him to spare time and join. Let me introduce him. Dr. Muralidharan Keshwar is a medical superintendent of NIMHANS, which is known as National Institute for Mental Health and Neuroscience in Bangalore. He currently works as a professor, Department of Psychiatric. He holds MBBS from Bangalore Medical College and MD Psychiatry from NIMHANS, Bangalore. He also holds Masters of Business Administration from Madurai Kamaraj University. He conducted researches in bipolar, disorder, depression, and brain stimulation modulation in psychiatry. He has at least 133 publications and 800 plus citations. He has more than 815 citations to his name and has executed more than 10 projects under his leadership. He's been awarded as Asian Young Psychiatrist Award by Asian Federation of Psychiatric Association. He's been also awarded as a Young Investigators by World Federation, Societies for Bipolar Psychiatry, Paris from France. And he's also awarded as a Young Investigator Award by the Research Society on Alcoholism, Washington, D.C. So that is a brief introduction of our speaker, Dr. Muralidharan Keshwar. I request him to share his presentation. Over to Dr. Muralidharan.
Thank you, Dr. Isaac, and a very good afternoon to all of you. And at the outset, let me take this opportunity to thank the organizers for giving me this opportunity to give a talk about a topic that is very close to my heart, that is the health of healthcare workers. And it's also a great honor for me to be sharing the stage with Professor Shekhar Seshadri, from whom I learned about psychotherapy, and he is my guru. So thank you, sir, and it's an honor to share the stage with you on this particular occasion, where we are talking about mental health of healthcare workers. So with that introduction, knowing that I have only about 20 minutes to make my points across to the room, let me go ahead with the presentation. So again, I thank Catholic Health Association of India, the Director General, especially for giving us this opportunity. I'll start with some disclaimer. I'm not going to be talking much about COVID-19 infection or treatment. Most of us have learned a lot about it by reading our WhatsApp messages. Some of us have bothered to read actual literature on this, so I'm not going to talk mostly about treatment of this condition. But what I'm going to talk about is how COVID-19 ended up becoming a catalyst for igniting what has been a very important issue. And considering that the Director General of CHAI is a doctor as a medical doctor, I can understand where the importance of this topic is coming from. So thank you, sir, for choosing this topic. So this is a brief outline of my presentation. I'll start with setting the context, talk briefly about the mental health scene in India, what is the scenario in terms of health and mental health of healthcare workers, particularly in the context of COVID-19, what can be done, and I'll end with a few slides on our own experience on how we handle this significant issue in the last 1 year. So, how do I define a healthcare worker? To going by the WHO definition, it's one who delivers healthcare services to the sick and ailing, either directly as doctors and nurses or indirectly as aides, helpers, technicians, and waste handlers. So when I use the term healthcare worker, I'm referring to all these people who are involved in healthcare services. Interestingly, WHO had declared 2006 to 15 as the decade of human resources for health. highlighting the importance that the healthcare workers play in ensuring a healthy community and a healthy country. However, the health of healthcare workers has continued to be the elephant in the room that no one wants to talk about, especially mental health of healthcare workers. For long, this has not been recognized, despite the fact that WHO has recognized the decade of healthcare professionals. We did not pay much attention to the health of healthcare workers. So much so to say, the tinge of humor that even the elephant in the room had to take therapy for itself because no one was paying attention to it. And then you have the COVID-19 pandemic that came in, and suddenly the importance of healthcare workers became something of paramount importance. And as you can see from the statement that was made by the World Health Organization in the observance of World Mental Health Day 2020, that the the theme for World Mental Health Day this year was greater investment and greater access to health, particularly for healthcare workers and those people with mental health conditions. So finally, after so many years, there is some amount of importance that is being attached to the health and the mental health of healthcare workers. Not only the World Mental Health Day, but even other days have started paying attention to the importance of health of healthcare workers. Like, for example, the World Patient Safety Day that is observed on the 17th of September every year. The theme this year was health worker safety, a priority for patient safety. Finally, we understood that the doctor has to be healthy or the nurse has to be healthy in order to ensure that the patient recovers or becomes healthy. The slogan for this year's World Patient Safety Day was Safe Health Workers, Safe Patients. And the call for action was Speak Up for Health Workers Safety. So finally, we had people paying attention. Remember, this is World Patient Safety Day, and the emphasis has been made on the safety and the health of healthcare workers. So finally, we have some amount of importance that is being attached. So moving on to the mental health scene in India. Now, if you look at the data from the National Mental Health Survey and from other important studies that have been published in leading psychiatric journals, you find that almost 1 crore of our population suffer from severe mental disorders, and almost 10 crore of Indians suffer from some mental illness or the other. It could be a minor mental disorder or it could be a major mental disorder. And that's a large number of people with mental health issues that we're talking about. And if you look at this map of India here on your right, where we looked at the prevalence of depression across India, you find that the states that are marked dark blue are the ones with the least prevalence of depression. And even there it is 2,750 people suffer from depression out of 100,000 population. So it's large numbers. When you look across the length and breadth of India, depression is something that's quite common. Whereas if you look at the kind of treatment that is available for mental health disorders in India, you can look at this. There's only one state where there is surplus of psychiatrists compared to the population, and that is in New Delhi. In no other part of the country are there enough mental health professionals to deal with the mental health problems that the country is facing. And if you look at the district mental health program, you can see that very few states are covered by the district mental health program, and even there the coverage is as close to the the lower end of the range as possible as compared to the 100% coverage. So this is the reality in terms of the available mental health resources for handling problems related to mental health, which means that there's always going to be a huge treatment gap between people who require treatment for mental health and what is actually available in the country. And as you can see, the 5 common psychiatric disorders that the National Mental Health Survey outlined, patients with the psychosis, with depression, with bipolar disorder, alcohol use disorders, the treatment gap, that is the number of people who suffer from this condition and the actual treatment that is available for them, the gap is more than 70%, which is an enormous number. This again just reiterating what I said earlier. So that the COVID-19 brought in with it newer problems. The number of people requiring mental health services had to face a problem because the availability of the resources became less on account of the pandemic. We all know that a lot of hospitals were closed, a lot of hospitals converted into COVID hospitals. So the available resources also became less, which means that the people who required mental health had nowhere to go for getting treatment. Further, COVID brought along with it a whole lot of mental health problems, including what many people have reported as the fear of contracting COVID or the fear of dying due to COVID. So many of these started coming in. So newer problems started coming in due to COVID, which means that the denominator of people requiring mental health consultation actually increased. So you find that the service providers decreased and the denominator has increased, which only widened the gap between problems and treatment availability. So what are the newer group of people who required mental health support? Those patients were diagnosed with COVID because our understanding about COVID was poor and nobody knew what was going to happen, who was going to survive, who was not going to survive. Further, there were a group of patients who were suspected of having COVID and were kept in isolation. This was in the first wave, where people were quarantined. Of course, a lot of it changed after July, August, but before that, there were a lot of people who were kept in the hospital till they were tested and declared negative. The frontline workers in the COVID wards and in the community, again, they did not know what COVID was all about, how COVID would be contracted, what exactly needs to be done. So a lot of anxiety and stress was there among these people, and family members of all of the above people who didn't know what would happen to their loved ones. In addition, healthcare workers working in non-COVID hospitals, because you never knew when COVID is going to hit your hospital and when you would have to be faced with the situation of handling COVID. And of course, mental health professionals who suddenly found that they had to deal with a whole lot of more people with mental health problems as compared to earlier. So, moving on to what is the importance of health and mental health of healthcare workers. Now, most of you would relate to this. If you worked in a government hospital, especially, or in a mission hospital, you would know that this was a standard scene pre-COVID, where a lot of people would be jostling for the attention of one doctor. As a result of this, the survey that was done in Hindu, I'm highlighting this particular article because this was done prior to COVID. So 82.7% of the doctors reported feeling stressed out in their work. A lot of them were due to the fear of violence, some of them due to the fear of being prosecuted. And with that, a lot of people were afraid of criminal prosecution on account of whatever, the cases that could be filed by people who were seeking consultation, simply because the gap is that huge between service providers and service utilizers. And if you look at this article that was published among the stress levels of critical care doctors in India, you find that there are a list of items which they've reported as causing stress. The most important being too much responsibility at times, being overstretched at times, and of course managing VIP patients is stressful at all times. Lack of professional satisfaction, talking to distressed relatives. So there's a whole lot of things which they've listed as stressors which impair their ability to function normally. What COVID-19 did was that it necessitated that all of us function as critical care doctors. Suddenly you found that the dermatologist was posted to work in the COVID ward, or the ENT surgeon had to work in the COVID ward. A nurse who was previously posted only in the minor OT was now working in the COVID ward. So you find that irrespective of our specialization, all of us were required to work as critical care doctors, which means that some amount of these stressors we had to adopt as a result of working in these areas. So this is the data from the NHS that I have shared here. So why do doctors or why do healthcare workers suffer from more mental health issues? This article refers particularly to doctors. That's why I put the term doctors. So stress is one, burnout is the other. Facing so much of stress all the time results in burnout, which means that they're no longer able to enjoy the work that they were doing earlier. A lot of times you find that doctors tend to talk about their overworking as a badge of honor. You find people saying that as a resident, I work 60 hours continuously. My residents are working for 72 hours non-stop. So this is not something that we should feel proud about. So overworking is not a badge of honor. A lot of us tend to be in denial and unable to recognize the problem. Further, there's a lot of stigma that is associated with recognizing being overworked or burnt out, which is why people don't seek help even if they're feeling that way. Guilt that they may be considered as inefficient or unsincere if they were to report feeling burnt out or overworked. So these are some of the issues why people would not report these issues, and fearing loss of job and reputation. So as a result of this, over time, what happens, there's actually a loss of empathy. So the doctors are not able to work, or the healthcare workers are not able to empathize with the patients like they would normally do on account of all these issues. And then we had COVID-19 came in. What happened? Suddenly you find that the number of people looking out for a hospital bed, or all of us would have encountered these situations, faced phone calls where somebody whom we knew or some friend of ours wanted us to find a hospital bed for them. So that was a reality, particularly in the second wave. And what happened? The healthcare workers had to face a lot of stress. Why? Simply because we are all ordinary individuals who are faced with extraordinary situations. And that, I think, is the bottom line about why the stress in healthcare workers is increased. We are ordinary individuals. Nobody has taught us or nobody has trained us what we should do in a pandemic. Nobody has trained us what we should do in a disaster situation when there are people who are dying all around us. And we are finding ourselves in a situation where we are unable to provide the necessary care and attention that they require. So we are faced with an extraordinary situation which is well beyond our means of handling at times. The number of individuals requiring treatment also has become disproportionate to the number of resources. Further, there's a risk of exposure to self. While treating COVID-19 patients, there is a great chance that the healthcare worker is likely to get infected. Initially, the problem was of lack of adequate protective equipment. You didn't get enough PPEs or no enough masks. And more importantly, the risk of infecting families. That was a major fear during any of the pandemics and in doctors who work with infectious diseases. That you will carry this infection back home, you will pass it on to your near and dear ones. And then this happened. I'm sure all of you would remember many of these things that happened in the last year. Suddenly, the people started labeling healthcare workers as superheroes. Like I just said, we are ordinary individuals trying to handle extraordinary situations, and the world is trying to label us as superheroes. Society is giving us this role. And suddenly you find that the responsibility has shifted from the health systems to the healthcare workers. We are trying to provide what we can in the limited resources that are available, and suddenly we are made to look like superheroes, and so the responsibility has shifted to the healthcare workers, which the society has assigned to us. It's not something that the healthcare workers asked for. So this has only added to more stress to the healthcare workers. So what are the common presentations of stress or mental health issues that we see in healthcare workers? Absenteeism from work. Suddenly you find that a lot of people are not reporting to work as regularly as they used to. At work, there's reduced job performance and productivity. A lot of people have experienced rapid changes in mood and anger. Some instances are there where people come to work intoxicated simply because the stress is too much to handle. This impairs their ability to function in the form of poor attention, concentration, poor memory, and also impaired ability to function on a daily basis. The opposite has also been seen. Presenteeism. You find a lot of people who you actually don't want them to come to work are actually coming to work. Like, for example, there was a period when we said that those who are 60 years and above, let them not work in the front line. But then you ended up with looking at a large number of people in this group who actually volunteered to work in the COVID wards. So they want to do more work than what is expected of them. So that's another thing that we had to deal with, which was causing stress for the other healthcare workers. More important things would be the ethical dilemmas and moral injury that COVID-19 has caused for healthcare workers. You have 5 patients who are requiring an ICU bed, and you have only 1 ICU bed. What do? You give it to who you think is the most deserving patient, or the patient who you think has the greatest chance of surviving, which also means that you're going to allow 4 patients to die. That is not something that healthcare workers are used to doing. We are not used to allowing people to die. We are used to saving lives. So suddenly you find yourself in an ethical dilemma which causes a significant amount of guilt and stress in the healthcare workers. Distress and anxiety related to COVID-19, and in a lot of people, worsening or exacerbation of pre-existing mental illness. The other thing that we saw in the earlier first wave, stigma. Healthcare workers, you find there were so many reports of healthcare workers being asked to vacate their premises, or they were not allowed to enter their colonies. While you had people banking plates on one side, you also had people not allowing doctors into the residential. Our own colleagues who work in NIMHANS, once the news got out that there are a few COVID positive patients, the apartments were asking them to get their COVID test done before they enter the apartment complex. You find that a lot of stigma was attached to healthcare workers, despite some trying to label us as superheroes. And of course, violence against doctors, I don't have to say more. This is something that is going on and on, particularly in the COVID care wards. You all know that so many hospitals, the doctors have been assaulted, the nurses have been assaulted, There have been ICUs that have been vandalized in the last few days. So the difficulty in dealing with the death of a loved one has also increased in the number of incidents of violence against doctors that we've seen in the recent past. So what are the common psychiatric disorders that have been reported in healthcare workers? One is post-traumatic stress disorder, depression, anxiety disorders, insomnia, and suicidal ideation. We could discuss some of these later, but these are the common psychiatric conditions that have been associated. Now, post-traumatic stress disorder is something that we usually associate with disasters or with an extraordinary stress that threatens the life and integrity of an individual. So this is something that we're seeing very commonly among healthcare workers now. And these disorders are seen more in healthcare workers than non-healthcare workers, more among nurses than other healthcare workers. Understandable, considering that nurses spend a large amount of time in close proximity with the patients. So that's something that's reported more among nurses than other healthcare workers now, and among women healthcare workers than men. So you can see that there are certain factors within the healthcare workers itself where some groups are more predisposed to develop mental health issues as compared to other people. And then this happened, the second wave hit, and then you started getting these reports, that the healthcare workers, a lot of healthcare workers have lost their lives. Now, of course, this is something that vaccination has been able to defer to a great extent or decrease to some extent. But when these numbers are put out, it's alarming. It's alarming for anybody who's a healthcare worker. And you can see that India, this is of course data from last year. The number of healthcare workers who've lost their life in India has actually gone up a little bit more. So this information comes out, which only increases the stress in healthcare workers, particularly those working in the front line. So these are some of the articles which I've referred. This is there in my slides, and I'm sure when it is shared, you'll be able to access these. So these articles talk about the importance of health, of healthcare workers during COVID-19 pandemic. What are the kind of impact that COVID-19 has had on the health and mental health of healthcare workers, and including some of the measures that have been found to be effective in preventing it. So what can be done? There are many things that can be done at an individual level, at a peer level, and at an institutional level. So what do we need to do? As the theme of this particular seminar says, self-care. Self-care is the most important thing. This is a time when we have to think about ourselves. We need to put ourselves first and then take care of ourselves before we are able to help others. I'll give you an example when we get to that slide. Problem solving is something that we all need to learn. Relaxation. And if we have pre-existing mental health issues, that is something that must be addressed. So remember, self-care is not being selfish. In fact, a lot of organizations have now put out self-care tips for healthcare workers. The first and foremost being to recognize the valuable role you and your colleagues play on the front lines. Practice self-compassion. In case you have any emotions that you're facing as a result of your work, try to validate them. It's all right to be angry. It's all right to be frustrated. It's all right to feel any of these because the situation is such that you could be feeling it. So there's no need to feel guilty about it. You need to understand that this is something anybody in your situation would feel, and find ways to try and see what positives can be there. So again, I'm sure you would have seen some of this being circulated in social media. So what are the things that you can control, and what are the things that you can avoid? Like, for example, the outer circle that you can see on this slide. You can limit the time that you spend on things that you can't control, and that includes to a great extent WhatsApp. Reading too much about the government policy, statistics, lack of infrastructure. So all the negative news is something that, see, remember, these are things that we cannot control. This is something that's beyond our control. Whereas the things that we can control are here. Focus on your diet, eat healthy, especially if you have lifestyle diseases. Limit the amount of time that you spend on social media. Do some kind of exercising. Don't try to socialize at a time when the risk from socialization is higher. Take all precautions that you can and help others wherever you can. Now, the example that I was trying to give was why self-care is important. See, when you're traveling in an aircraft, the air hostess tells you in case of an emergency, you first put the oxygen mask to yourself before you put it on your neighbor. That's because you need to be alive. You need to be awake if you have to help the person next to you. And that is the kind of situation that we are facing with this current COVID crisis. So you have to first help yourself so that you are in a position to help others. And this is something that NIMHANS has also put out as a part of our helpline. I'll touch upon this later. But these are some of the self-care tips that have been suggested. Do deep breathing exercises, focus on your strengths. Try to be in the present and deal with the challenges that you're facing currently. Meditation and recreation as much as possible. Exercise. This is something that is going to come up frequently. Within the limitations of movement and other restrictions that the governments have put, try and exercise and relax as much as possible. And this is what literature also says. So in terms of the evidence that is available, exercise appears to be the one that helps healthcare workers the most, especially during stressful times. Having access to an individual therapist has been helpful in many people. Important thing is to have the support of peers and superiors. Of course, it's also important to have practical support with insurance and compensation, and look at positive ways in which health or mental health can be improved. And what can we do at a peer level? As a group of people, you have to enhance social support, establish buddy systems where a group of people can help each other. And that's what the evidence available also says. So education and training is the most important peer level intervention that has helped enhance the mental health of healthcare workers. Having a group of people with whom you work together, bond together, at work, has helped in maintaining the mental health of healthcare workers. And of course, clear communication is important, and measures that can address the stigma associated with COVID-19 and mental health is something that has been found to be important peer level intervention in preventing mental health issues in healthcare workers. And at an institutional level, there are many things that can be done. Establish mental health support systems, enhance awareness, ensure family support, especially take care of the doctors and healthcare workers in quarantine who have additional needs, and as far as possible, try and influence the policy makers so that some of the healthcare workers can benefit from it. So I'm going to just briefly talk about the NIMHANS experience and what we did in order to address the health and mental health of healthcare workers. The first and most important thing, education. Lack of education, lack of information is what causes a lot of stress. So from March 1st last year, even before the WHO could declare it a pandemic, we started our educational programs for all cadres of staff. Importantly, we tried to focus more on the less informed groups like the housekeeping staff, the security staff, who may not have access to this kind of information. The education was also about the preventive measures that one needs to take in order to ensure that they stay safe, and also about the treatment and recovery options that are available. And we resorted to using online platforms for these classes. It's a dynamic process, as all of us know, and these educational programs are still continuing. In terms of staff well-being, it was important for us to ensure that misinformation is avoided and staff have access to crucial information. So we started off with putting out some bulletins. This was not there earlier. We started it during COVID. This is to ensure that the staff are aware of the policy decisions that are being taken in the institution, and that the administration is paying attention to their anxieties and their needs, and that the hospital policies will take care of you in case you do fall ill. I think that information had to go out to the staff to take care of their mental health.
Dr. Muralidharan, it's a time. It's a time actually.
Should I stop?
Yeah, we gave you 5 more minutes extra actually.
Okay.
So you can take 1 more minute to wind up. Yeah.
Fair enough. Thank you. So I think the other thing
take 1 more minute to complete that.
Sure. So we've started off a helpline for the mental health related issues, and we've given this is part of the national helpline also. This is for the healthcare workers to avail mental health support. A lot of administrative things were done to ensure that the exposure and categorization of risk was done. We started doing antibody testing, which we've done thrice till date. I know this is one of the most reassuring things for the staff. I really don't know why, but they felt reassured when we started doing antibody testing, and the reports are sent to all employees. We've opened a quarantine center for our staff, and we also have COVID care centers, much like how the government is opened. And to say that about 300 to 350 staff have utilized these facilities till date so that they can stay safe from COVID. The most important thing, ensuring personal protection. I have just put this slide to let you know that the investment in terms of personal protective equipment has been quite high to make sure that the healthcare workers feel safe. And of course, from January 16 this year, we have started off a vaccination program in tune with the rest of the country, and 5,000 plus healthcare workers in NIMHANS including security guards and everybody else, have been vaccinated till date, and now we are vaccinating the family members of our healthcare workers. And of course, NIMHANS has been involved in policy making with various organizations to ensure the health and mental health of healthcare workers are addressed. So to summarize, the health and healthcare workers' mental health has been much neglected. Of course, there is more and more recognition now on the need for addressing health of healthcare workers. It's important to understand that self-care is of utmost importance, and all organizations must invest in the health of their own healthcare workers, particularly of mental health. So again, there will be a lot of issues that are still left unaddressed. A lot of times, the health of healthcare workers don't translate into actual policy decisions. But I think each institution or organization has to start to take care of the health of our healthcare workers. And of course, like I said, self-care is most important. So we need to take care of ourselves. So with this, I'll apologize for overshooting time, and I'll stop here and leave you with this image of NIMHANS from 1936. Thank you.
Thank you, Dr. Muralidharan. Thank you for very enlightening presentation. Facts presented are very alarming, and we understand that the time given to you was not sufficient. But we also understand that this is not the only webinar of this kind. We will need to have more and more, because the needs are much beyond our expectation, beyond our imagination, actually. So thank you so much, sir, once again for sparing your time. And as a time, we move to our next speaker, Dr. P. Shekhar Seshadri. And let me introduce Dr. Seshadri is graduate from his MBBS from Maulana Azad Medical College, Delhi. His postgraduate in Psychiatry from NIMHANS, Bangalore. He currently works as a senior professor and Dean of Behavioral Science in NIMHANS. And besides working with child and adolescent mental health, including developmental disabilities, he is actively involved in the areas of gender and sexualities, violence, trauma, and abuse, juvenile justice. He is also involved in teaching, training in life skill education, community and social mental health program, forum, theaters, and qualitative research. And I don't know how many of you know that Dr. Seshadri is elder brother of a very famous classical dancer and Bollywood actress Meenakshi Seshadri. So thank you so much, sir, for joining and accepting our invitation. Over to you, sir.
Thank you very much, Newton. I want to draw your attention, friend, to the extraordinary presentation that Murli has made. This is an example of how a sensitive practitioner who understands systems and administration, and an able administrator who understands the sensitivities of the domain. This combination was presented so evocatively and so comprehensively in what Murli has shared. What I would like to do now is actually get into the whole issue of well-being and resilience of healthcare service providers from an entirely personal perspective. I would like to start, friends, with an article that was published on 17th of May by a Delhi-based journalist called Mohammed Asim, and I acknowledge Mr. Asim's evocative and poignant tale. This is very important for each of us to really think of ourselves in the context of this pandemic, because almost the 300 of you who are present here, perhaps some of you have had COVID, perhaps some of you have been hospitalized, perhaps some of you have had family members who were hospitalized and were serious, and perhaps some of you have lost friends and loved ones. Perhaps some of you have experienced concerns with the family, including parenting challenges. Perhaps some of you have experienced upset and anger with the system for the inability to access adequate health care. I quote from Muhammad Asim: if pain is personal and individual, which is so often the case, it can drag us down to a solitary hole. But when it becomes shared and collective, pain can lift us out, extracting us from solitude into the company of those who are suffering as well. This is very critical for Chai as a network and for all of you present here to understand and look at Asim's story. He says, for days I nursed my pain deep within me, being the elder son who had to look after ill parents, mourning the loss of their loved son-in-law to COVID. I didn't have the time and space to process my emotions. I had to be strong for my sister and her two teenage children who lost their father and partner in a cruel fashion. I couldn't cry in front of them, could I? So I vented one day in a Facebook post. I had to recount each and every horrid detail that I and my sister went to clear the burden in my heart. The post was me crying out loud. Writing, as they say, is cathartic. Please keep that in mind, friends. Then came a deluge of calls, messages from friends, from people I know, as also from total strangers. Thousands poured their hearts out. They showed support. They shared my pain. I got some of the most poignant and emotional messages from people that I had lost touch with or haven't met or spoken to in years. Many shared their own experiences and what they are going through. I felt their pain. We became one. Our timeline and inboxes are a tide of grief and suffering. Who would have thought that condolences, RIP, broken heart emojis would become the top prompts on our phone keypads? All around us, the deluge of pain, desperation, everyone is overwhelmed. We ought to share it, tell others about ours, and listen to theirs. No one will emerge unscarred from this pandemic. Everyone has been hit in some way. Muhammad Asim says, my heart cries for kids orphaned in a sudden brutal stroke. A dear friend who's part of a counseling collective was asked to talk to a 5-year-old who lost both his parents to COVID. The child tells her that everyone around is mourning and hasn't had the time to talk to him. But I have lost my parents, no, just 5. What can anyone tell the boy to make him feel better? I cry with a professor friend whose husband is battling for his life in the ICU. She couldn't properly mourn a friend she had just lost. I have to stay strong for my son and husband, she says, sobbing over the phone. I let her cry for some time. There are few people in front of whom you can cry your hearts out. For others who look up to you for strength, you put on a brave face. What do you tell a single mother who loses her only son, just 17, to COVID? Will any words ever bring closure for her? You can only share and feel her pain. A very close relative looks after a special needs child at home while his wife is struggling for life in the ICU. He is himself unwell, but cannot think of his own health. The child asks him, "Is Mama going to become a star?" Thankfully, his mother came back home. On a video call arranged by a good doctor in Calcutta, a young kid sings, "Tera mujhse to pehle ka naata koi," to his mom, breathing her last. Final goodbyes, no matter how painful, are important. Can you ever listen to that song again without crying? A 19-year-old nephew who recently recovered from COVID goes to donate plasma in the middle of the night to a total stranger after an appeal on a social media platform. His mother is scared about him going to the hospital in the middle of the night, but she allows him to do so, staying awake and praying till he returns. They both feel good about helping someone in need. The nephew gets to know the next day that the person didn't make it. He grieves a stranger. Pain binds us all. This bond is the only system that is working today. Otherwise, every sob, every cry, every scream, every share, every helping hand, every fading heartbeat is a monument of our shared grief. We will carry it and mourn it for the rest of our lives because we are no more just individuals who are suffering. We are all part of this collective pain. The biggest aspect that affects us as healthcare providers, as indeed the world at large in this pandemic, is intolerance of uncertainty. And the only antidote to this uncertainty is social cohesion and solidarity. The only way we can help ourselves is by maintaining these networks and by sharing and by the principles of connecting, connecting, and connecting. I want to go back to the points that Murli made about recognizing burnout and what one needs to do in order to prevent it. Please recognize, friends, that all of you are doing the best that you can under the circumstances. We are not superhumans. Errors and mistakes might happen, but you're doing the best that you can under the circumstances. So, in order to maintain equanimity and well being, to prioritize our lives, to maintain journal writing and diary writing, to keep in touch with our friends, our old classmates, our extended family, to keep in touch with our hobbies, with nature, with the world at large, so that our existence and consciousness is not bound and constricted in only living out a connection both in thinking and in experiencing with the reality of COVID. This is not to say that you cannot, you should not think about it. Of course, you will have to, because this is part of a world consciousness right now. But what is happening is part of who all of you are as human beings. You are many other things as well. And your roles and responsibilities in addressing COVID as healthcare providers may occupy a significant proportion of both your time, your thinking time, your preoccupations, and your work. But if it is not exclusive to that and you maintain your pre-COVID and your aspirational aspects of identity, your family, your friends, your hobbies, your gifts, your talents, and do all the stuff that Murli has spoken about, whether it's yoga, whether it's mindfulness, whether it's meditation, whether it's gardening, whether it's cooking, to make that balance so that the equanimity and courage that you have or you need to actually face the brutal reality of what COVID brings is kind of balanced and offset, at least to a certain extent. Emerging, therefore, into a post-COVID world relies exclusively on solidarity and social cohesion. And as a network and as individuals, if you maintain this social cohesion, this would, from a personal perspective, in addition to the systemic and hospital-based and network-based perspectives, many of you may be administrators, many of you may be practitioners. Please remember all the stuff that Murli has spoken about in terms of decisions that you can make to mitigate the kind of stress and tensions that people who work under you in a healthcare system can face, so that they feel supported, they feel understood, they know that they have backup systems in case something happens to them. That knowledge and assurance makes it that much easier then to deal with the tensions there. And the last word on parenting: when you assist your other colleagues who have young children who are not able to go out into the world, how do you bring the world back into the homes? For adolescent children who are annoyed and irritable because they are not able to lead out their aspirations and their peer interactions, I have taken the liberty to put on chat a national initiative and integrated resource for child protection, mental health, and psychosocial care, which NIMHANS in the Department of Child Psychiatry is executing for the Ministry of Women and Child Development. These links have an extraordinary amount of material, including a series that we did recently on COVID in children. How do you deal with children's anxieties? How do you address child protection? How do you communicate bad with children and communicate bad news? How do you deal with loss and grief? That please feel free to see these links and pass them on to the child network so that more and more people connect to the challenges that families face in maintaining developmental trajectories of the children who are equally in consternation with this pandemic. I wish you all, friends, the best of health and safety and courage and equanimity in negotiating however long it will take for this pandemic to resolve. And I wish CHAI as a network all strength and power in continuing to do the yeoman service that they have been doing for so many years, and for allowing me the opportunity to share this platform with my colleague, Dr. Muralidharan Keshwan. Over to you, Newton.
Thank you, sir, so much for your time and inspirational message. It was very encouraging. You have touched almost, I believe, everyone's heart with your very heart-touching message. And I know this is just beginning and a lot more has to happen in this platform. And I hope you will continue to be with us in this our journey. So thank you so much for joining us, sir. And we'll keep in touch. Thank you so much, sir.
Thank you.
Now, shall we move forward? And it's a time we have Dr. Sister Annie in our midst, and we had requested her to share from her experience. Thank you, Sister Annie, for joining us. Let me have a small introduction. Sister Dr. Annie is a cardiologist by specialization, currently works as a director and chief cardiologist and PS Mission Hospital, Maradu, Cochin, Kerala. She also teaches cardiology department at St. John's Medical College Hospital in Bangalore, holds MBBS and MD from Bangalore University, and she also holds a postdoctoral in medicine and cardiology from Rajiv Gandhi University of Health Science, Bangalore. Currently, she is a board member of CHAI in Kerala. She was also joint secretary for CHAI from 1996 to 1998. So thank you so much, sister, for joining us. Over to you, sister. Please go ahead, sister.
Hello, yeah.
Please go ahead.
Dear Father Dr. Matthew, Director General Chai, Dr. Sister Beena, President SDFI and team, dear sister doctors and all my dear sisters listening to me. First of all, I thank the team for this opportunity to given to me. Today, we are here discussing about the stressful moments and events we face in our day-to-day life, especially in the healing ministry. I am just sharing few experiences, and we all just think, what are the causes of stress we face in our day-to-day life? Maybe the intense work schedule, that is almost 24 hours per day we are engaged. We see life in the midst of COVID patients. We have to find out time for academic, legal updating, fulfill the directions given from the health and government authorities. In this time, we get very less time for our own self care. Eat, pray, sleep, relax, above all, be with our family and the supporting and caring persons around. Many of us, as head of various institutions, we face difficult times, especially in decision making. We hold multiple responsibilities. We face financial burden in between. Sometimes we may not get expected support from the expected persons also. What are the symptoms we face? We see as due to stress. We may be more anxious, irritable, depressed, more silent, maybe unhappy. We may not get sleep in night. We have loss of appetite, unable to make decisions. We may be unable to pray also. In such situations, in our hospital, I could say, what are the steps we take to provide care and support to our staff? The whole institution we see as and function as a loving and caring family. Multitask functioning, that is, the staff share their duties and help each other. We rotate staff from stressful place to other areas. We get honorary service from others also, so that it may lessen the burden of staff. We give medical and financial support to the staff and maybe to the family members also.
Sister
We give,
Annie, can
yeah,
I just interview we can't see your face. Can you adjust your laptop a little bit? What we are seeing is only half of your face. Yeah, yeah, very good. Thanks. A little more, sister. Little more.
okay.
You have to adjust it a little more. What we are seeing is only top of your face. Correct. Yeah. Good, good. Go ahead, sister. Thank you.
We rotate staff from the stressful areas to other areas, and we get honorary service from the others, so that we can lessen the burden of the staff. We give medical and financial support to the staff and also to the family members. We give free safety measures like in the work area, like PPE, food, stay, and create job for our own people by sharing the job creating areas. These are the suggestions I suggest to decrease the stress of us. Eat well, drink more water, exercise in between, get fresh air at times, sleep. Maybe make up your sleep even in the night and day. If you don't get time to sleep in the night, get some time during day. Relax some time, arrange prayer sessions, motivational talk, and educational sessions, maybe online also. The suggested means are: evaluate every day at the end of every day. See how much we are in the stress level, aware of one's own stress level. You can evaluate by seeing, thinking, and meditating. What is your inner peace level? Are you joyful and happy? Are you satisfied in the wherever you are? And then also, everyone should understand that during this time of COVID-19 pandemic, everybody is in stress. Not only we, each person, each family member, each employee, employer, everyone. Certain level of stress is very much expected, and there is, of course, a higher level of stress, maybe also in us. And you experience, see whether if you are a head of the institution, even in the middle of all this problem, if you can feel peace and satisfaction in each one, that is a thing that we are at peace. We are able to do things more scientifically and efficiently if you are the head of the institution. That is also give you, even in the middle of stress, one certain amount of satisfaction and peace. So be happy, content, and thankful to God for each and every moment as a wonderful gift from God. Thank you.
Thank you so much, Sister Annie. Thank you for reminding us that the ultimate source comes from our God to face and fight such crisis situation. Thank you so much for sharing from your experience. Thanks for joining. Yeah.
Thank you. Thank you.
Now, I see some of them are joining late. Please don't feel bad. We will make this recording available so that you can have the entire webinar available to you.
Newton, can I just, your face is also seen partially. Can you just arrange that?
Yeah. Thank you, Father. Yeah. Now we have Sister Thomasama Yadunapalli. I invite her. She is currently working as administrator of St. Teresa Hospital, Hyderabad. And she's done Bachelor's of Physiotherapy from MGR Medical University, Chennai, and Diploma in Healthcare Administration from St. John's Medical College, Hospital, Bangalore. And she has worked as a president of Catholic Health Association in Andhra Pradesh and Telangana for 5 years. Currently working as a secretary, Catholic Bishops Conference of Andhra Pradesh and Telangana. Thank you, sister, for joining. Over to you.
Thank you, sir, for your introductory talk. I would like to share about St. Teresa's Hospital, Hyderabad, what we have started as a COVID block in our hospital. So, I'm Sister Thomasam speaking from St. Mary's Hospital. We have started COVID block as a suspected COVID ward after the formulation of the protocols in coordination with the management, consultants, and quality department. First, we started as a fever clinic on 18th May 2020. Once the patient is screened, he or she will be sent to fever clinic. The doctor will see and prescribe some medications. If required admission, they send them to the ground floor. We name it as a COVID suspected ward. After confirmation with COVID-19 positive report, patient will be admitted in COVID block and treated as per the protocols. During this process, the management and staff has faced a lot of problems and difficulties to adjust with the new environment and lack of staff also we have in the hospital. Finally, with cooperation of the team, we have managed as a COVID ward and it is going on. And also, we have treated some of the COVID cases in 2020 142, suspected COVID cases 200, COVID 19 cases treated in 2021 354. We also vaccinated our entire staff, doctors and paramedicals, and all the healthcare workers, and totally vaccinated general public 5,000. So we have in our hospital stress related process. There we have faced a lot of problems and difficulties in the hospital as we have started the COVID block, especially mainly the nursing staff shortage and short shift of working of the nurses, inability to recover between the shifts. Sometimes nurses will be absent, overtime working, extended shifts more than duty hours, sleepless nights they have, increased demands from the patients and families. And these are the causes which affected the subjective feeling of the tiredness of the staff and doctors, mentally and physically penetrative, interference with cognitive ability, interference with one's ability to concentrate on the work, and sustained sense of exhaustion, feeling of tiredness among the staff and doctors. These are the effects resulted into patient safety, medication errors, poor decision making skills, nurse safety. It is a big question mark sometimes. Disrupted circadian rhythms like mental and physical behavioral changes, decreased performance at work. They we used to get burnout in the during the work as they are treating the COVID patients. Next. The type of support we gave to our employees during the COVID time, emotional support to our team, even like expression of empathy, trust, love, and care. Esteem support shown in expression of confidence, encouragement, and pointing out someone's strengths and validations. Informational support given by gathering resources and sharing the information to help others. Tangible support also was given, taking on the responsibility for someone so they can deal with problems and try to help them with the problems, bringing food, picking up the kids, doing dishes, etc. We also supported the staff during the pandemic, like St. Mary's Hospital. We have staff, all the staff has been vaccinated. During the pandemic, all the healthcare workers, doctors, nurses, housekeeping, and other staff are protected with all the sufficient PPEs, N95 masks, gloves, and sterile, etc. And our hospital also provided the free treatment to the COVID-19 affected staff and doctors with complete staff, motivated to rework with more efforts to help the pandemic society. And we also faced some problems with patient attenders. Like sometimes they are not satisfied the care and all. Though we give care night and day, but we thank God for the help they have given us during the support. Entire staff and doctors, they helped us a lot to treat the COVID patients. Thank you.
Thank you, Sister Thompson. Thank you for sharing your experience. I think we are slightly behind schedule, so we'll move forward. And we have now Sister Marina Graham. and she is a nurse practitioner by profession. At present, she is in charge of Holy Cross Health Center in Guwahati in Assam. She has done her bachelor's degree in nursing and completed the nurse practitioner course from China, India. She has worked as a president of Catholic Health Association in Northeast region for 6 years. So we welcome you, Sister Marina. Over to you.
Good evening to fathers, sisters, and all well wishers. I stand here from Assam, belonging to the congregation of the Sisters of the Cross of Shavano. I am Sister Marina Abraham. I am very happy to come before you and say a few words about the health ministry. As a nurse, I am carrying out in a small health center. Our health center is known as Holy Cross Health Center. Now we also have added a wing on dental care. There we have 2 doctors who are BDS. So now turning to me, towards God and towards others is the call for me and each of us has received. Yes, these words were focused in the ministry of health. Thus, in these challenging and critical situations of science and technology, the pandemic virus is a threat to one's own life. Yet, I am happy and we are able together to say that we are able to stretch out our healing touch to our needy brethren with a smiling face and with respect and love. In fact, I am proud to say, though the fear and anxiety has increased with the arrival of COVID-19, the health persons who is working with me always come with many doubts, fears and anxieties at times. We alone are managing the patients. We have no diagnostic facilities. We have no doctors who can inspire us and guide us, but yet I can't have no doctors. Coming to my health personals in this center, what I have to tell you is that though the fear and anxiety was there, yes, trust it. First day, we all were silent. How to go about it? Their questions were, Sister, how will we face the life? How can we meet the patient who knows that they are having COVID-19 and will we be infected? Intensely, we started to pray, calling out the Psalm 91 and placing every member in this institution and whoever the patient who come to this institution under the protection of the Lord. So it is still today continued. At the same time, we also try to give some counseling to the health personnels through the talks, and at the same time, who are the people who are able to give them a nourishing experience in the divine healer with the retreat centers and retreat preachers. So, thus, gaining in the power of the Lord, getting the support of the different people who have encouraged us to continue the ministry, yet remained. We don't have many facilities. How can we go about? When we come together, we discuss all those things and we find time to cherish and take some snacks, relax ourselves and have some laughter and clearing the fun, the doubts and anxieties of ours daily. We also practiced self-care activities which we can continue like hand wash, continuous hand washing and daily morning and evening inhalations. At the same time using mask, face shield etc. When the deaths are arising in surrounding villages, the fears are there, yet we can say this small center of ours radiating a selfless love, care, joy to the surrounding humanity who comes to our care and whomever we meet. Thank you.
Thank you, Sister Marina. That was wonderful sharing from your experience, and I'm sure participants benefited. It's time we move to question answer session, and I request our Director General, Father Matthew, to facilitate the question answer session. Over to Father Matthew.
Thank you, Norton. Dear friends, I think we are almost nearing the time, but with your permission, maybe we'll extend this to another 10 minutes or so. We have Dr. Murli and Dr. Sheshadri with us to answer your questions. Can you project those questions, please? Yeah. So these are some of the questions that came from the group. How do we deal with COVID phobia, that is a fear of getting infected, our own or others? How can we help the geriatric population? Okay, these are different questions, but can spiritual activities help to deal with the COVID phobia? These are some of the questions. There are other questions as well. So I leave it to both of you to figure out who is going to answer, Dr. Murali or Dr. Sheshadri. Who would like to answer the first question?
Well, I can take the first and the third. I'm not exactly an expert in the geriatric population. As you know, I'm a child psychiatrist.
Okay.
Let me start with the whole business of COVID phobia and the fear of getting infected, our own and others, that the best public health approach is common sense. And the best vaccination, other than the actual vaccines being given, is the mask, particularly for the under 18s, because the trials is not over yet for the under 18, and this whole business of the third wave and all the concerns around that. So I think that a public health approach, when we look at a pandemic of this nature, particularly to an enemy that is more or less invisible. So the SMS paradigm, S sanitize, M mask, and S social distancing, stands good as an approach to take in order to work with this fear. As long as you follow this, you're more or less and safe. And the amount of, let's say, immunity that it provides you from getting infected, if you do all three, other than the vaccine part of it, is a very significant issue. So one is public health practices, the other is scientific, sound, and simple information. The third is clearing misinformation and myths. And the fourth, of course, is adequate resources and information about the services that are available. Because the anxiety always is, what if this happens? What if I'm not able to access that? So to have these resources at hand through networks or through the media would be important. The last point regarding activities to deal with COVID phobias, Murli and our sisters who spoke, and I have spoken about so many activities that really serve not just to distract you, but also to give you direction, to give you purpose. So it's not merely one of distraction. Any activity that helps you deal with the fear is legitimate. If these are spiritual activities, so be it. People have different kinds of beliefs and different kinds of practices. They are all legitimate. If something works for you, by all means, do it. I take the extended definition of the term spirituality, which is not necessarily linked to religion, but something that gives you a certain upliftment. And this could be very anthroposophic. So spirituality has a much larger definition and field of operation than mere religious practices. So these are some of my responses. Over to you, Murli.
Thanks, Dr. Sheshadri. I think there is also a how along with that spiritual activities. Maybe this person was looking for, is there a basis, a scientific basis or something? Or is there how does it work, the spiritual activities, to deal with
Well,
phobia?
if you actually look at the data on some of the what we call as the third generation, extending into fourth generation cognitive behavior therapy practices, particularly those that are based on mindfulness, we have enough evidence that some of these practices, which are kind of linked, mindfulness activities are kind of linked to to imagination and to focus of thought processes. Its impact on actually alleviating anxiety has been well established. Now, the process of how this is done is both in a prescriptive way that you do it at certain times of the day, but you also do it at times of heightened tension and heightened anxiety. So it becomes both a regular practice to basically tune your autonomic nervous system in a way that when there is a threat, that the system does not respond to it in a flight or fright response there. So that's the way that it really works.
Thank you. Dr. Murli, you may have to take the second question.
Sure, sir. So just to add, a couple of points to what Professor Shekhar has very beautifully outlined. How do we deal with COVID phobia? One of the things I think we all need to remember is that the in acquiring the COVID or in getting infected with COVID is something that can happen either as a part of an occupational hazard for healthcare workers or in the general public. So the three things which they keep talking about in terms of the preventive measures, it's something that people should take very seriously. So as already mentioned that hand hygiene is something that something extra that I wanted to mention. So hand hygiene, wearing adequate protective equipment, and social distancing. If these are practiced adequately, I think the risk of getting the COVID is much less, and that is something that we need to help people with fear of catching COVID understand. So in terms of how can we help the geriatric population who stay alone, well, that's a very important question for 2-3 reasons. One, the geriatric population is the more vulnerable population as far as COVID is concerned. These are a group of people or elders who have very different needs. Some of them may require assistance. Now, if you're talking about a group of young people who live alone, they can be independent. Whereas you're talking about a population that actually is quite dependent on other people. It could be a house help, it could be a cook, it could be a security guard, it could be any of them. So this is a group of people who are medically more ill, more vulnerable to catch COVID, and who actually are dependent on others for their day-to-day activities and sometimes for their day-to-day life. So this is a group of people whose needs are very different. Now, what can be done for them? I think it's important for them to stay what you would call as reverse quarantine. That's something that is being advocated from the time COVID started. It's important for them to stay alone from other people. While the amount of face-to-face contact with people at home and the people who visit them should be minimized, there should be other ways in which they should be made connected with the rest of the world. So one of the things that we have done as a part of our geriatric mental health services is that we've initiated the online consultations for elderly people who were not able to visit us. So there are two things that we did. One, we started off with calling out to people who are due for visiting the hospital. So people who were supposed to come to the hospital after a month or 2 months, for whom we had given appointments, then the lockdown happened and the COVID hit. So the hospital enabled the contacting of these elderly population. We started calling up their family members, started explaining to them that yes, we are available for telephone consultation. So that is one of the issues that people are worried about. And I think we are not the only hospital. There are a whole lot of hospitals which have initiated telephonic or telemedicine-based contact and consultation for geriatric population. We also made avenues available through which they could get in touch with us as and when required, so that the health needs of these people can be addressed. Again, one of the things that the geriatric population face is the fear of death or fear of help being unavailable in case of a medical emergency, particularly in the times of COVID. Those are fears that they may have even other times, but in this time, in this period, that fear had actually heightened. So to have them connected with a group of people, probably in the community, if it is an apartment complex, to have people connected to them whom they can call at any time so that their requirements or needs can be met. So this was one more thing. So access to healthcare, access to people who can provide them with access to healthcare. In addition, health promotional activities. So one of the things that we did is we started off with these online yoga programs, which we have emailed the link to all. It is available on the Demand website, and anybody and everybody can access that. So these are home-based yoga programs that we have. They run twice a day, every day, without fail, at 7 in the morning and at 4:30 in the evening. The focus is more on the elderly people with medical illnesses. The focus is more on breathing exercises rather than asanas, which they can do. So these are some of the things that, apart from all the things that we've outlined as part of self-care, these are some of the extra things that I could share, which we have done and found to be useful in the geriatric population. The most important, of course, is protecting them with vaccination and ensuring that they get priority in terms of vaccination, which is what we've done both for our staff as well as the family members of staff who belong to the geriatric age group. Thank you.
Thank you, Dr. Murali. Can we move on to the next questions?
I will answer the first question on this slide.
Sure.
How do we calmly deal with caregivers, families who keep asking questions for which we have no answers? This is something that I'd like to share, and sometimes the questions can be really difficult. Like for example, we had a patient who lost their family member asking us, "How did the chief minister survive when my father died? He is the same age." How does one answer this question? And then you have the print and electronic media advertising that many of the politicians, especially the senior people, have recovered from COVID-19, and suddenly the hospital is at loss to answer how relatively younger people passed away, the reasons for sudden death. So I think what we have understood is that a lot of these questions come up because the communication to the patient and the family is not happening on a regular basis, and I think that is the single most important factor that needs to be taken care of by all the hospitals. This is something we have recommended even to the state health authorities, that there has to be an information cell. There has to be a person who gives information about the medical condition of the healthcare worker, of the patient who is admitted into the COVID ward or in the COVID care unit, because family members are not able to gain access to them. So that's some of the things that the hospitals have done. So they've provided a contact person who will update them. There are fixed times during the day in which the information about the patient was admitted either in the critical care ward or in the COVID ward to be passed on to the family members, and the information about deterioration should be passed ASAP. There should also be mechanisms by which some kind of a video connectivity can be provided. Of course, it's not possible in all hospitals, but at least a telephonic conversation between the treating doctor or a healthcare worker and the family member on a regular basis. Sharing information about the medical condition of the patient is something that can, to a great extent, prevent these kind of questions at a later date. We should remember that these are the kind of questions that come to us after a patient has suddenly deteriorated or there's a sudden loss of limbs. So I think sharing information regularly at fixed times is the single most important thing which one can do to prevent this problem. Over to you, sir.
Well, as far as the relationship between fear and depression and death is concerned, let's understand that anxiety and depression are sometimes related phenomena. One can be primary and the other secondary. And when there is intolerance of uncertainty and fear, it can certainly lead to upset and distress. Now, any medical condition, whether it's cardiac or whether it's diabetes or whether it's asthma, uh, can anxiety exacerbate pre-existing medical conditions? If you look at psychosomatic medicine, there is some evidence that mood states do contribute to either the progression of an illness or to medication response. But the relationship of extreme anxiety to death in COVID-19 has not been scientifically established. Unless you make some erroneous medical decision because of panic, it's not a direct relationship, and then it's a decision that may be detrimental to actually seeking early treatment. So that's the way that one would look at this. As far as tips for helplines are concerned, uh, I'm I'm not sure that we'll have the time to go into the nuances of the do's and don'ts of a helpline as opposed to face counseling. There is some helpline etiquette which is generic because you can respond only to the voice. You don't have body language and facial expressions. And sometimes you're limited by time. You can't have a 2-hour session on a helpline. You have to give the right response that. So some of the things that you need to keep in mind is that you need to understand what the context of the call is. What information are they seeking for, or what trouble or predicament are they articulating? And to be able to discern that as quickly as possible and respond appropriately. It's also important to keep a list of resources at hand, because many times these calls are for information. So you need to have that information at your fingertips. And there are a whole set of what we call as first level responses. So if it is anxiety, what can you say? And there are some do's and don'ts. You shouldn't say things like, don't worry, it will pass over, because that doesn't help. So what are helpful responses and first level responses? And Murli referred to this when he spoke about psychological first aid. So first level responses in psychological first aid are established techniques, and some of these tips are available, for example, in the WHO psychological first aid original document. And if you require more tips, from our own existing helpline and the center that NIMHANS runs for psychosocial support and disaster management, we would be in a position to send some of this material to CHAI to pass on to their networks. Over to you, Newton. Over to you, Father Matthew.
Thank you. Shall we move on to the next questions? Yeah. Who would like to come in? Dr. Murli or Dr. Seshadri?
Psychosocial counseling. I think maybe Sir can answer the first one.
Well, counseling and handling COVID stress, the availing of the pandemic, there are two aspects to this. One is that a lot of reassurance and mitigation of tension can occur personally and internally by your own contacts with your friends and well-wishers and extended family, and to do some of the things that I spoke about, keeping in touch with your hobbies, with mindfulness practices, following your talents, taking time off, structuring your day in a way that you do things according to a plan, don't take on too much. But at another level, when you approach helplines and so on, it is essentially a platform for your predicament to be heard. But because in a universal health disaster of this nature, everyone has preoccupations, and not everyone is receptive to someone else's predicament, because we are all in the same boat. And therefore, you may approach someone and have a response that is not helpful or even dismissive. Or rejecting, and it's in that situation that the mere platform to be heard by a helpline uh, at least is relieving, because your story is heard, your predicament is heard, and you're given responses that are helpful. And this takes you to a level where you don't feel alone and unsupported. This is one of the generic functions that any kind of counseling and helpline serves. Um, I will also take the second one in terms of positivity. That, see, the Spanish influenza, in which upwards of 30 to 50 million people died, did ultimately end, and 100 years went by, and so this pandemic will end. We don't know when. It may take 2 years more, it may take 3 years more, till everybody is vaccinated, till we reach herd immunity, or till the virus and its mutants lose their potency, however long it takes. Surprisingly, friends, the economy seems to be doing well. You look at the stock market, it seems to be doing well, except that migrant workers and daily wage workers are really facing the brunt of. And I think one of the ways to remain positive, uh, as Mohammad Asim pointed out in his blog, is solidarity, and in sharing, and in social cohesion. And that's the only way in which we maintain our positivity and our beliefs, belief in ourselves, and the fact that we will come out of this with some level of resilience.
Thank you, Dr. Sesha. Dr. Murli, would you like to add something more?
Yes, Matthew, I think I've touched upon this in my presentation on what can we do on a daily basis for self-care and good mental health. So there are a list of things that one should do and a list of things that one can minimize or avoid. So what things that one can do, even based on evidence from literature and from personal narratives, is exercise, eating healthy, taking care of one's medical conditions well. So ensuring that people with medical conditions ensure that their problems are treated adequately. Other things like relaxation techniques, be it prayer, meditation, yoga, spirituality. So these are some of the things that need to be done on a daily basis. But the most important thing is to make time and to have conversations with important people in your life. It could be friends. I'm sure many of you have done that in the last 1 year. Suddenly you had a Zoom call with friends from school, or Zoom call with friends from your medical college, or all of us have been doing it, and that's extremely important to think out the box and see how we can stay connected with our important ones, even though physical distancing is something that is being recommended. So these are some of the things that can be done regularly, frequently. In terms of what we should not do, there's so much of information out there that it's important for us to recognize what are the authentic sources of information and what are just WhatsApp forwards that have no authenticity. It's important for us to train our minds to be looking at the authentic information and see how we can utilize this. Even with authentic information, it's important for us to recognize what is the more positive information that is there. Like for example, you can see if there are the number of deaths, the numbers may be high, but then you can see that the number of deaths are coming down. The positivity rate. So instead of focusing on more about the negative aspects of the pandemic, you can also see the number of people who recovered, have gotten and gotten better, have increased. The infrastructure, though it was not found to be wanting in terms of the second wave, but I think with adequate planning, like what we were able to do at Hands, we were able to handle the second wave fairly well. So a fair number of positives. So in terms of the information that is available, there's so much of hue and cry about oxygen being not available, but at the end, it was in a few centers. So to be able to recognize that yes, this is not a general problem. This could be a problem associated with a few centers. This could be a problem associated with few people. The deaths could be occurring because of other medical problems that are there in the individual who passed away. It's possible that it's because they did not get vaccinated. So there are many things that could determine the negative outcomes also. So for us, it's important that we pay attention, even with the negative information. We should try and take the positives out of it so that we can maintain our peace and mental health. So I think these are some of the points that I
Thank you, Dr. Murali. Yeah. Any more questions, Newton? I think that's fine. I think it's also time. So we need to slowly wind up. Thank you so much, Dr. Murali and Dr. Sheshadri. Newton, over to you. We have a formality of a formal.
Yes.
No, the last word belongs to the president of the organization. That is Sister, Victoria. Yeah, over to you, Newton.
Thank you, Father, for leading that session. It was very interesting and very learning. Psychological first aid was one learning for me. And positivity, solidarity, and coziness are a reminder to us that is going to help us in days to come. Now, I request Sister Victoria to give the concluding remarks as well as give away a vote of thanks. I know it's a very difficult task, but thank you so much for accepting our request and doing this for us. Over to Sister Victoria. Now, let me introduce her. She is a MSc Nursing, holds PhD in Hospital Management, Inpatient Central Care. My sincere apologies, Sister. I did not use word doctor. Yes, Sister Dr. Victoria is currently Provincial Councillor of Guntur Province of Jesse, Mary and Joseph Congregation. She holds the responsibility of Coordinator for Healthcare and Social Ministries of the province. She is the principal of St. Joseph College of Nursing, Nalapadu. She has more than 30 years of experience in the field of healthcare. So thank you so much, Sister, for joining. Over to you.
Thank you, Dr. Newton Isaac. And first and foremost, I like to thank for this golden opportunity to end the program with the concluding remarks and also vote of thanks. And as the time is very short, I don't want to elaborate very much. And the presentations were very simple and understandable and inspiring. And so, first of all, I like to thank Dr. Newton Isaac for facilitating the program very well and in a systematic way, and also introducing the persons in a meaningful way. And I thank him for all his contribution for organizing this webinar and also taking a master of the session of this webinar. Thank you, Dr. Newton, for your contribution for the success of this webinar. And also I thank our Reverend Father Matthew Abraham, who is the sole master of these webinars to promote in the healthcare workers the awareness regarding the COVID-19 and also how to handle the COVID-19 patients and also for supplying various materials to treat the COVID patients. For all your contributions during this COVID period, and I especially thank for today's webinar and also giving the welcome address and also handling the question and answer session in a meaningful way and clearing the doubts of various people who has put their questions, and our resource people have very meaningfully has explained regarding the questions that need to be handled by the various people. So I thank you for all your efforts for the welfare of the healthcare workers and the member institutions. Thank you, Father Matthew. And I especially thank the expertise of this mental health and who has availed themselves to be the resource persons of today's webinar. I personally thank Dr. Muralidharan Keshwan, the Medical Superintendent and Professor of Psychiatric Department. As for the today's meaningful theme, that is self-care and reliance building of healthcare professional during COVID-19, you have aptly dealt with the theme and you have given very meaningful and also very inspiring message talk regarding the self-care and also health of the healthcare workers during this COVID-19 pandemic. And you said health workers' safety is mainly depends upon the priority of for the patient safety. So that is true. As we focus today the Consumer Protection Act, patient safety depends upon the healthcare workers. And also you have brought out very meaningfully the trace levels of CCU doctors in India, and it is mainly on stress, burnout, overworking, denial, not recognizing. The same points also some of the sisters, doctor, sister, administrator, and also the uh, nurse professional also has expressed. These are some of the main problems that is um, that need to be dealt with the people as an individual and also at peer level and also at the institutional level. Then you also have explained regarding the gap has increased because of this COVID-19. The psychiatric problems become more in the individuals and also in the families and especially in the healthcare workers. So you have you have beautifully explained how we need to deal with these things as an individual and also what we can do to individual or peer level or institutional level you have brought up. So we thank you, Dr. Muralidharan Keshavan, for your expertise session that you have delivered during this webinar and also all your contributions during the question answers and your experience and also the activities that you have personally undertaken in your institution to help the healthcare workers. So I thank you on behalf of CHOI for your contribution and sharing your knowledge and your experience. Thank you, Dr. Muralidharan Keshwan. And also I thank Dr. P. Sheshadri, and he has mainly dealt with the grief of the individuals as an individual and families and also the health workers who have lost their dear and near ones. He has said in various ways how we can deal with it, and he said the anecdote maintaining the network of sharing by the connecting with the people and also having contact with the various people and diverting oneself at various level, that is journal writing, diary writing, keeping touch with the friends, etc. So thank you for your heart-touching message that you have expressed, that is your empathy and sympathy, and moreover the compassion is very very essential while we deal with the healthcare workers who is tirelessly or generously contributed their might for the welfare of the humanity. So thank you very much, doctor, for your contribution and for your valuable suggestions and also your motivating or inspiring thoughts that you have extended, and also answering the questions and answers and helping us to think differently, how to relieve our fear and anxiety, and how to extend our services to the COVID patients. And especially the counseling is very important as an individual, families, as a attenders, etc. Thank you for all your inspiring message and also your experience and your expertise. Thank you, sir, for your contribution. And I especially mention that is you have experienced in a individual level how the grief need to be handled. So, dear Dr. Shekhar Sheshadri, we thank you on behalf of, I thank you on behalf of CHOI for all your contribution during these webinars. Thank you very much. And I also thank Dr. Annie Sheila, and as a doctor, how she personally encountering the various problems as a doctor, as a head of the institution, and also as she deals with the other co-workers in the institution. So she also expressed mainly the stress and anxiety, how we need to be handled. Especially she focused on the spiritual aspect of the individuals, which in turn strengthens each one, gives courage to go ahead in the service. So thank you, Dr. Sister Annie Sheila, for your sharing and for your putting before us your personal experience, and which in turn helps us to think further how we need to handle the stressors during our service. And I also thank Sister Thomas Amma as the administrator, how she has started the COVID center as a fever care, and also slowly she established a COVID-19 center, and also she has given during 2020 how many people she has served, and this year in the second wave more than 300 patients they were treated successfully, and how she also helps as a single unit of the institution as a family, keeping everyone together and extending the concern for each other, and trying to extend the compassionate service to the people, and also especially the health workers during their service, how to handle the stress and how to cope with their duties and etc. Then as Sister Marian Abraham also shared, she mostly stressed on loving care and compassion. Today, mostly we are thinking that is a healing touch is what the world most needs today. So she has expressed, always she has extended her services with love and compassion and smiling face. So everyone in a different aspect, as a doctor, as an administrator, as a nurse, how they try to handle the situation, how they were also found the various aspects to deal with the stressors until they are energetic to extend their services through the team of healthcare workers for the welfare of the humanity and also for the well-being of the individuals. Then finally, I say that is every person needs love, compassion and kindness. When we are able to extend our love, compassion, and concern for one another. Every person is able to overcome from the stress level and also from the difficult situations, whatever may be they are facing. So, as I conclude this webinar, lastly, I like to say that is, let us all feel that is, we are not individuals, we are family members. As a family, the world is not, as Dr. Sheshadri was telling, every pain that is experienced by the individual is not related only to the individual, it is connected with the world. It is a collective pain. So, as we are seeing the present situation, we also feel that this fear and anxiety, the stress that every health worker is undergoing may be understood by every individual, as an individual and also as a collectively as the institution, and let us support one another and let us build a confidence that we are for one another and we are here to care for the individuals and also the humanity. Thank you very much for giving me this opportunity. And once again, I thank all the resource persons and also the persons who have taken a opt theme to conduct this webinar. Thank you. Finally, I thank Father Matthew and also Dr. Newton for organizing this webinar. Thank you very much.